On behalf of Bancroft Brain Injury Rehabilitation, I'd like to welcome you to this afternoon's Heads Up webinar. I'm Lynn Tomeo, and I'll be moderating today's event, Play It Smart, What You Need to Know About Sports Concussions. Bancroft is pleased to offer educational opportunities such as our Heads Up webinar series, designed to give brain injury professionals the opportunity to gain new insights from our clinical experts while at the same time earning educational credit. Today's webinar is credentialed by CCMC for Nurse Case Managers and CRCC for Certified Rehab Counselors for 1 CEU. General attendance certificates will also be given for 1 clocked hour. Our presenter today is Dr. Cynthia Boyer, Executive Director, Brain Injury Services at Bancroft. Dr. Boyer has more than 20 years' experience as a clinician and administrator in neuropsychology and brain injury rehabilitation. She has adjunct faculty appointments at Rowan University, Widener University, and Philadelphia College of Osteopathic Medicine. Dr. Boyer has ancillary privileges in the Department of Neurology at Cooper University Hospital and is a medical rehabilitation surveyor for the Commission on Accreditation of Rehabilitation Facilities, or CARF. She serves on both boards of the American Brain Injury Specialists, ACTIS, and the Brain Injury Alliance of New Jersey. She is licensed as a clinical psychologist in Pennsylvania and New Jersey. If you have questions during the presentation, please enter them into the chat area located on the side of your screen. We'll address questions at the end of the presentation. And then following the presentation, you'll receive a brief survey via email, which will enable you to receive a certificate for participating in today's session. So thank you again for joining us, and now I'll turn the event over to Dr. Boyer.
Thank you, Lynn. Good afternoon. It's my pleasure to share with you some knowledge about sports concussions. For many of us, we are in the midst of the fall sports season, so it's very timely that we talk about this topic. As you know, there has been a greatly increased focus on sports-related concussions. There are a few reasons for this. Concussions are increasingly common in sports, and their frequency actually appears to be increasing. We'll talk about that a little bit later. In addition, although most sports concussions are mild, there is a high risk of recurrence, and they can have significant complications. In addition, we really know very little about the impact of concussions on the developing brain, and although sports concussions in professional sports gets a lot of news and a lot of coverage, most folks are concerned about sports concussions in their children, in young children, adolescents, and college-age individuals. Our knowledge of the potential long-term negative outcomes has really come from pro sports, pro football in particular, and we're trying to determine how this relates back to younger individuals. So what is a concussion? The definition of concussion has changed dramatically over the time that I've been in practice. The current definition, which is still evolving, indicates that a concussion is a complex physiological process that affects the brain. The concussion is induced by biochemical processes inside the brain. And these processes occur secondary to either direct or indirect forces to the head. What happens to the brain in a concussion, the disturbance of brain function, is not related so much to anything structural. There's no fracture, there's usually no hematoma. However, there's something that happens metabolically inside the brain, and that is what causes the symptoms of concussion. Because of that, concussions are typically associated with normal neuroimaging findings. So it's not usual that you can diagnose a concussion by an MRI or a CAT scan or any of the typical ways that we diagnose more serious brain injuries. Concussions may or may not involve a loss of consciousness. This is actually one of the major changes in the definition of concussion over time. For those of us who were trained quite some time ago, we remember when the diagnosis of concussion categorically required a loss of consciousness. this is not so anymore. What happens in a concussion is, because of the neurometabolic processes that occur, there is a range of physical, cognitive, emotional, and sleep-related symptoms that happen in the individual. These symptoms may last from several minutes to several days to weeks, months, or longer in some cases. And it bears noting that these symptoms do not always occur immediately following a concussion. So you can see that diagnosing a concussion is really quite difficult. The current diagnosis of concussion, just to recap so we're all clear, does not require a loss of consciousness, does not require a direct blow to the head, does not require amnesia, and CAT scan findings and MRIs are likely to be normal. So we're not going to talk directly about diagnoses today, but you can see that just diagnosing a concussion is really the first challenge in concussion management. I wanted to share with you some statistics about sports concussions so that you can get a little appreciation for the scope of the problem. It's estimated that in the United States there are over 3.8 million sports-related concussions per year. Now, not very long ago, this estimate was 300,000. So you can see that there's a rather dramatic change in estimates from 300,000 to now 3.8 million. It's estimated that an athlete playing a contact sport has about a 19% chance of suffering a concussion each year they play. I want to relate this to some more recent statistics that have been published by the NCAA. They really have a very robust surveillance program. So for the year that ended in 2010, there were 1.85 million possible athletic exposures to concussions. And they define exposures as either a practice, a game, etc. The rate for fall sports concussions was 1.9 per 1,000 exposures. So you do the math and you can see that that's a significant amount of college-age individuals who are sustaining concussions. Overall, there has been a kind of flattening out in the incidence of concussion at the college level. The rate has stayed about the same for about the past 8 years. And that's quite significant because up until then, the rate was climbing. And from the period from 1980 until 2004, the rate really climbed pretty precipitously. In younger individuals, ages 8 to 13, levels have not yet evened out. And that is an age group that we're concerned about, and that is an age group where we see still increases in concussions. Concussion is very common in youth sports, and let's talk about really what happens in sports that causes concussions. If you think about the definition of concussion, things that can cause concussions are other players. People bump into knees, they bump into elbows, they bump into other body parts, head-to-head contact. There are falls that happen in sports, body-to-body collisions, falls involving ice in hockey, the ground in many sports, in baseball and football, and falls in basketball where you're falling on a hardwood court. There's also equipment involved in some sports that can lead to concussions. Balls, bats, goalposts, hockey sticks, lacrosse sticks, soccer balls. So many, many different types of external objects can lead to concussions. So what sports carry a risk of concussion? I think I may have missed a slide, but anyway. The most common sports that are involved in concussions are, as you probably could guess, basketball, football, lacrosse, ski jumping, ice hockey, field hockey. Those are pretty intuitive. We realize that there's a lot of physical body contact, so we understand that there would be concussions involved. However, there are a lot of other sports that have limited contact where there's also a significant risk of concussion. Baseball, bicycling is a big one, cheerleading. You don't think about cheerleading as a sport where concussions can occur, but oftentimes in the formations and so forth, there can be falls involved. Other things like flag football, gymnastics, volleyball. Almost any sport that someone could be involved in really carries some risk of concussion. You can see in this slide the incidence of head injuries per sport in 2010, and this is for all sports. It may be surprising that cycling actually has the highest number. However, if you look at incidence per participant, football certainly carries the biggest risk. So while numbers may be big in cycling, there are so many people that participate in cycling, it's really a smaller risk overall. But baseball, basketball, water sports are all up there. And this just kind of evens out the list. There are gender differences in concussion. What we know about brain injury in general is that more men than women sustain traumatic brain injury. And this is pretty much true from puberty through middle age. After middle age, there are some changes. But what we found in the concussion literature is that women seem to suffer concussions more often than men, and their results may be somewhat different than men. We're not exactly sure why that may be. However, there are some speculations that it's due to gender differences in physical body strength, particularly neck and upper body strength, perhaps due to hormones. It may be due to reporting differences. It may be due to different types of sports that females tend to be involved in. And as the picture demonstrates here, the sport where there is the highest incidence of concussions in females is soccer. The second highest is in basketball. So women in sports certainly have a high incidence and a high likelihood of sustaining concussion. I want to talk a little bit about the mechanisms of injury in concussion. This schematic shows you that there is a coup, contra coup type of injury in concussion very similar to what happens in what we are acquainted with in traditional traumatic brain injuries, if you want to think about it that way. The brain, in a linear fashion, the brain strikes an object, moves back and forth in the skull, and then as you see in number 3, it moves backwards in the skull as well and hits in the back area. So that tears and stretches many of the axons and neurons in the brain. But that's just one type of injury. So you could see for somebody running forward in football, somebody driving to the basket in basketball, perhaps somebody heading the soccer ball, that would be a linear type of injury. There also can be rotational injuries that cause concussions. And this is where the head, instead of going in a straight line type of trajectory, goes more in a side-to-side motion, almost the way you might see kind of a bobblehead doll kind of bobble back and forth. And this causes similar types of injury. However, the axons are torn kind of in the opposite direction. But again, it's that striking of the brain within the skull and that stretching and tearing of the neuron that contributes to the concussion. This next picture really demonstrates, for those of you who may have forgotten your high school biology, really what a normal neuron should look like. That's what you see all the way on the left of your screen, the normal axon, and you see the lining and the sheath is all covered. In the middle picture, you see, because of that back and forth linear motion or that rotational motion in the skull, you see that the trauma causes the axons to twist and in some places to actually tear. So it's almost like there's a long string, and as it's going back and forth, it gets twisted up, and if it's pulled far enough, the tension can actually cause the string to actually tear and to break. And the picture all the way to the right shows you that in post-traumatic condition, and this is where there would still be symptoms, in very mild concussions, what you would expect to happen is that as time elapses, the neuron would go back to its normal state. When it doesn't go back to its normal state because of many factors involved in the concussion, you'll have post-concussion syndrome, and we're going to talk about that just a little while later. But what the last picture of the neuron shows is what happens to the neuron and what it might look like for folks who do not evidence a full recovery. And that is that the axon does not completely go back to normal. A little bit of it recovers, but it doesn't recover completely. And the result is that that particular brain cell or cluster of brain cells actually dies. Let's talk a little bit about the pathophysiology of concussions, because if you recall when we talked about the definition of concussion, really what we're talking about is what are the processes metabolically that go on inside the brain that cause the symptoms of concussion. So what actually happens to influence what happens to the axons? There are metabolic abnormalities that occur as that axon is tearing within the brain. I'm going to tell you the biochemistry, but there will be a take-home message from this, so don't worry about remembering the exact biochemical substances that change. But potassium, glutamate, and glucose are all immediately released from the affected brain cells. So from those axons that we saw on the pictures, these chemicals are released. As they're being released, calcium is entering these cells, which are undergoing a disturbance. They've been torn. The chemicals that they need for their survival and for their functioning are flooding out, and other chemicals are flooding in. In addition to the calcium entering, there's also a neurotransmitter release that happens. And the bottom line with this is that there's decreased cerebral blood flow. This next slide really shows you, kind of in picture form, a really nice graph of what happens. Now, if you kind of remember what glucose is a sugar, and it's what the brain uses for energy. So when glucose goes down, that means that there's really no available energy for that cell. So that cell is not able to function the way that it needs to. you see at day 0 where really everything is going down, but over time you see that these substances actually start to recover. The glucose recovers, the blood flow recovers, and then all of the lines are where they need to be all together again, so that blood flow, oxygen, and glucose are all at the rates that they need to be, all at those expected rates. So the take-home for this is, metabolically what happens is there's an energy crisis in the brain. You don't need to, as I said, you don't really need to remember what chemicals are involved, but remember this if you don't remember anything else. What happens to the cells in the brain causes an energy crisis. There's not enough energy for the brain to do what it needs to do. And because of this energy crisis, the brain is especially vulnerable to further damage until that recovery that we saw on the preceding slide takes place. When concussions occur, there are some symptoms that require immediate medical attention, and I have them listed here. These symptoms would include changes in alertness and consciousness, seizures, muscle weakness, persistent confusion, remaining unconsciousness, vomiting, unequal pupils, any unusual eye movements or walking problems. So any of these symptoms would require immediate emergency assistance so that the individual is attended to by a physician or taken to the emergency room immediately. The other symptoms of concussion that we're going to talk about, and the next slide shows you a really neat poster, one of several that the NCAA has sponsored, and it outlines the symptoms of concussion. And one of the things that we know is that athletes don't always report symptoms of concussion accurately. Hopefully this is changing, but the symptoms of concussion are listed here, and we're just going to kind of go through them kind of quickly. The typical symptoms of concussion, and the one that's most prevalent and occurs in nearly all concussions, is headache. And that happens whether or not you hit your head. And if you think about what we just saw with the metabolic changes, that makes sense. So there are things going on biochemically inside the brain that can cause a headache, in addition to if the head strikes something. Other symptoms include nausea, vomiting, balance problems and dizziness, fatigue on one hand and drowsiness, trouble sleeping on the other hand, irritability, nervousness. People report feeling slowed down and foggy. They have difficulty with their memory and concentration. They can have double vision. They can have ringing in their ears. They can also have sensitivity to light and noise. These concussions may appear 1, 2, 3, all of them, a couple of them. It may be all of the physical symptoms and none of the cognitive symptoms, or vice versa. There's no real rhyme or reason so far that we've been able to detect in terms of which concussion symptoms occur. Now remember, athletes don't always report concussions because they want to play. They want to continue to play in the game. They don't want to let their teammates down. There are lots of reasons why folks underreport concussions. So it's important to know, as a parent, as a coach, as an athletic trainer, as a spectator, how can you tell, perhaps, if somebody's had a concussion even if they're not reporting the symptoms? So there are some signs that you can observe, and they're listed on this slide. And these include things like somebody appears dazed and stunned. I think that for those of us who watch football, we can see people who get up after a play and they're kind of wobbling around, and you're pretty sure that they've had a concussion whether or not they're reporting it. And thankfully now the NFL is very good about taking people out of the game, and we're getting better and better at this in other levels of sports, particularly college and high school, and even some of the younger youth sports. They may be confused about an assignment or position, forget an instruction, ask questions slowly. They may have had a momentary lapse in consciousness. They may not recall things that happened before the hit. Sometimes these types of signs that we see have been referred to in the past as bell ringers. I got my bell rung, and before we really understood what concussions were and the implications of concussions, people who played sports got their bell rung and went right into sports. We now know that a bell ringer is the same thing as a concussion. So we're backing up our definition and backing up our vigilance and our management farther and farther in terms of the symptomology of concussion. So even the very least amount of symptoms really require attention. And that's because we really don't know what the cumulative effects of concussions are. We do know in adults and in professional players that there's an increased severity of symptoms with subsequent concussions. We know that without a doubt. We don't know about that in children. We don't know what happens on the developing brain. We don't know how that influences further development at all, and that's one of the things that we're studying and one of the reasons why it is so important to be careful about the incidence of concussions in children. A condition that has received a great deal of attention, and which I believe you'll understand better now, understanding the pathophysiology of concussion, is second impact syndrome. This is a very, very rare event, but when it does occur, it's extremely serious, causes significant problems in the individual up to and including death. And what this is when an individual experiences a second concussion before the cells in the brain have had a chance to recover. So before the symptoms of the first concussion have resolved, before the brain has resolved its energy crisis and gotten back to those normal levels, if an individual sustains a second concussion, it may result in rapid and often fatal brain swelling. And for this reason, many states, including New Jersey, where I'm speaking from, have enacted laws protecting children and requiring them to be taken out of games after signs of a concussion and requiring certain types of medical clearance before they re-enter a game following concussion. I'm not going to go into those laws because they're different for every state, but when we get to the resources at the end of the presentation, you can look up what the laws are for your state. But that is really what the impetus behind the laws have been. And this second impact syndrome appears to happen in children, but not so much children and young adults, teenagers, early 20s, not so much in adults. To my knowledge, I'm not aware of it happening in any pro sports. Okay, so the take-home from this, and we'll repeat this a few times, athletes should never return to sports while they're still experiencing symptoms of concussion, and this is something we've learned along the way. Let's talk a little bit about post-concussion syndrome. Now, individuals can sustain concussions in a variety of ways. We're just talking about sports concussions today, but you can sustain a concussion from a fall walking down the street, from a car accident, from many, many other activities. Statistically, for individuals who sustain a concussion, about 20 to 25% of those individuals have long-lasting or residual symptoms. And those are, we'll talk about those symptoms, but they're really the same symptoms as you suffer immediately following concussion. Interestingly, it's estimated that less than 5% of individuals who sustain sports-related concussions suffer those residual symptoms. Now, what we don't know is it because they're not reporting those residual symptoms or because there's something different that goes on with folks who sustain sports concussions. Perhaps there are individual differences in physical fitness, etc. The symptoms of post-concussion syndrome, it's a tongue twister, are very similar to what you see immediately following a concussion, and the most common symptoms are headache, dizziness, sensitivity to light and noises, blurred vision, and cognitive problems, particularly problems with concentration, attention, and memory. Most individuals who have post-concussion syndrome do recover rather quickly within 3 to 6 months. So again, it's that recovery at the cellular level, but for a certain proportion of the population, it takes a little bit longer to recover. And for a very small proportion of the population, these individuals continue to experience residual symptoms. Let's talk just very briefly about the long-term effects of concussion. And most of what we know about the long-term effects of concussion come from our professional athletes, particularly professional football players and increasingly professional hockey players. But the most knowledge comes from professional football players. What we've seen in individuals who have had multiple concussions, and we're talking about many concussions, not 2 or 3 concussions, but maybe 10, 15, 20 concussions. We're seeing an increased risk of cognitive impairment, an increased risk of depression, and in some individuals, an increased risk of very serious condition called chronic traumatic encephalopathy. There are actually 2 research groups studying what's called CTE, for chronic traumatic encephalopathy, and the only way this is diagnosed and studied, similar to Alzheimer's disease, is post-mortem. So there are actually 2 brain banks that are studying the brains of professional football players who have died. And what we have found so far from looking at the neuropathology of these brains is that they have similar protein distribution of a particular protein called tau that's seen in Alzheimer's disease. The brains of these players look very, very similar to individuals who are many, many years older and who have significantly advanced stages of dementia, and dementia of the Alzheimer's type in particular. Most recently, this condition, chronic traumatic encephalopathy, was diagnosed in a college football player who committed suicide last year, I believe, at the University of Pennsylvania, and his family donated his brain to the project that's studying this. So it's a very significant problem, and certainly when we're thinking about children playing sports, it's something that really we need more information about. This is another example. We're going to talk about education, but this is an example of something that the NFL is doing to really educate their players about concussion. Use your head, don't lead with it. So when we talk about concussion management, really the most important thing is if there are absolutely any signs or symptoms reported or observed by the individual, there should be no return to any sports activity at all. So for any signs or symptoms, no sports activity. The second most important thing in concussion management is overall a period of rest. Think about that biochemistry in the brain that needs to recover. The only way that the brain can recover its energy is through rest. If the individual is engaging in other activities, that requires energy from the brain, so therefore the brain isn't resting. So when we talk about rest, we really mean rest. That means no texting, no TV, no reading, really pretty much as complete rest as you can have the individual engage in. Easier said than done, I realize, but that's now what we have as the best course of concussion management. And then a very graded, gradual return to play. There's a stepwise progression where individuals return to play and they're monitored for symptoms of the concussion, and if those symptoms return, then that is an indicator that the brain has not recovered and the individual needs to go back to resting. There are many clinical dilemmas when it comes to really working with individuals with concussion. The first of which I touched on when we talked about the diagnostic criteria. Because the diagnosis is a bit on the fuzzy side, you don't need loss of consciousness, you don't need to hit your head. The dividing line between what is a concussion and what isn't a concussion is really a moving target. So that's a dilemma to start with. When you think about the elements of management that we just reviewed, there really is no proven course of treatment for concussions at this point in time. The best treatment we have is to let the injury run its course. And we're actually using observation to determine if the brain has recovered. We don't really know if the brain's recovered. We're assuming that if the symptoms don't return, that means the brain has recovered. But we don't really know that for sure. There's no chemical test, there's no imaging test to know this. So we're really not totally certain about when it's absolutely safe to return to play. We don't know how many concussions are too many. The general rule of thumb in sports is that if an individual has 3 concussions, they're pretty much done for the season, but there's really no science behind that magic number 3. Depending on the severity of the concussion, it may be that 1 concussion the individual needs to be done. We don't know. And last but not least, until the concussion has resolved, and remember, we're doing this all by observation and correlation, we really don't know what the severity of the concussion is. And there isn't necessarily a correlation between the severity of the impact and the severity of the concussion, the same way there is in traumatic brain injury from mechanical injuries. So in terms of concussion management, this is a nice little acronym that I think is useful, and it comes from Children's Hospital of Boston, their sports concussion clinic. So remove the athlete from play, refer to a medical provider, specifically someone who's experienced in concussion management, a neurologist preferably, rest, no sports, no texting, no TV, no computer, it should say as well, and return to play only with medical clearance. So you see that it's a very conservative management strategy, and that is really what we need to do to keep young players safe until we have more information about the cumulative effect of concussions on the developing brain. Okay, I actually really addressed these already. These are the we don't knows. So since there's so much we don't know about concussion, similar to traumatic brain injury, one of the best ways to treat concussions is to prevent them from happening. So some ways that we can prevent concussions is really by teaching safe techniques in practice and play. So the NFL has actually changed some of its rules to make concussions less likely. The kickoff returns are different. There are different types of penalties. The Pop Warner Football League has stopped doing tackling in some of its practices. So the way that we engage in sports, the techniques that we use, and how often there's body contact is changing. We're also, and you saw this by some of the examples of locker room posters that I shared, really encouraging recognition and reporting of symptoms so that we can prevent cumulative effects, so that we can prevent multiple concussions, and so that also we can hopefully prevent second impact syndrome as well. And also to be particularly vigilant with younger athletes because of differences in their bodies and actually differences in their skills, in their motor functioning. With concussions being more common, we need to be particularly aware of and ready to intervene in terms of teaching those younger kids how to play safely and when they need to be sitting out. There are, as I mentioned, many developments at the legal level in terms of diagnosing concussions and return to play, and I encourage you all to find out about that through your local Brain Injury Association or Brain Injury Alliance Association. In addition, Think First, which is a prevention program for head and spine injury prevention, has some nice injury prevention programs. And it goes without saying that for some sports, bicycles in particular, helmets are really essential in being able to prevent concussions sometimes. There's also education. And as we get ready to wrap up for today, I wanted to mention a few programs in particular. The Heads Up program, which is sponsored by the Centers for Disease Control, CDC, has an excellent education program called Heads Up Concussion in Youth Sports that you can find on the CDC website, and we have it included as a reference. It includes downloadable symptom sheets for parents and coaches and athletic trainers. It includes posters. It's a great resource for educating yourself and educating the athletic teams in your area. So I bring that to your attention. The NCAA also has some wonderful concussion education materials. And what you see on your screen now is a fact sheet for student athletes that talk about the symptoms of concussions, how to prevent concussions, and also what you should do if you have a concussion. And they also have a catchy slogan: it's better to miss one game than the whole symptom. When in doubt, get checked out, which is kind of a takeoff of when in doubt, sit them out. So think about that as well. The National Association of Neuropsychology on their website has some useful educational videos about concussions in football and in hockey that you can access. There also are educational videos on the Brain Trauma Organization website as well. They really work with all levels of brain injury, typically more involved brain injuries, but have some concussion educational materials as well. So I have some resources listed on the screen for you. I want to point out, this is something that I found by looking around, but the Center for Sports Concussion at Idaho State University, www.noconcussion.org, is a wonderful resource for information about concussions. Has some great information and great links to other websites. I mentioned the Center for Disease Control, www.cdc.gov, In New Jersey, we have the Sports Concussion Center of New Jersey, www.sportsconcussionnj.com is a very good resource. Also, the Women's Sports Foundation. If you look that up, I believe it's womensportsfoundation.org. For those of you who work with female athletes, that's a great resource in terms of looking at gender differences and how to work with girls and young women a little bit differently. So there are a lot of good resources out there for you all to access in terms of educating yourself, educating your coaches, educating players, and doing what you can to really make people aware of the symptoms of concussion, the risks of concussion, and the best way to manage concussion. Another concussion resource, this has a tear-off pad similar to what I shared about the CDC, and this is www.sportsconcussion.com. Better to miss one game than the entire season. And I think all of these slogans and posters are really a way to engage athletes, because athletes can be very dedicated, as I said, to their sports and to their team. So we need to impress on them how important it is to take care of themselves so that they can go back to playing either later that season or the next season. So thank you for joining us in our webinar today. I know that there has been at least one question that I wanted to address, and that had to do with the symptoms that require emergency intervention. So I will review those. If you bear with me, I will find them, and if you have other questions, please feel free to forward them.
We have, Dr. Boyer, we have one question here that is asking, with regard to mild traumatic brain injury or concussion, do we see more in regard to limited contact sports, because most of those sports don't involve wearing protective gear? So, for example, gymnastics or horseback riding or snowboarding, where individuals aren't wearing protective gear, do we see more incidents of concussions in those sports than perhaps other sports where individuals are wearing protective gear?
That's a great question. I suspect that that is a factor. I also think that, you know, if you think about some of those sports, really protective gear in some ways might interfere with the performance of the sport. So it's a balancing act in terms of how to prevent. The incidence is not as great, but again, any time that you're active, and remember, it's not just in sports. If you're walking up and down the stairs, if you're on a ladder, you know, when your body's in motion, there's a risk of doing something that might cause you to fall or have your head rotated in such a way to sustain an injury. But certainly protective gear can cut both ways. Sometimes in some sports, having protective gear can make people be bolder and take more risks because they think that helmets protect them from concussions. And really what helmets do is protect the brain from skull fractures. The types of movements that we see of the brain and the biochemical things that happen are not necessarily always due to contact. So while the helmet may mitigate in some respects, in other respects it may not. So I think the jury's still out on that. I did want to do the emergency symptoms so that you can have them. They really are changes in alertness and consciousness. So if there's a significant change in alertness, any loss of consciousness, really that is an emergency symptom. Any seizures, any persisting confusion. So even if the individual has not lost consciousness, but if there's persistent confusion, if you see changes in the eyes, unequal pupils, and unusual eye movements. The eyes are really a reflection of what's going on in the brain. So if you see differences in eye movements or pupils, that's an indication that there's something going on that needs to be attended to. And also muscle weakness either on one side or difficulty walking. Lastly, and this is a category unto itself, seizures. Certainly if there's any seizure activity that requires medical follow-up. So those would be the emergency symptoms. The other common symptoms that we noted of concussion don't necessarily require emergent, immediate medical care. They require monitoring, but these symptoms require immediate medical attention.
Okay, thank you, Dr. Boyer. We have one other question, and it kind of, I know that you alluded to it for a brief moment in the presentation, the long-term effects of these cumulative concussions. So are these athletes who are suffering from concussions, can they lead to difficulties or other diseases later in life? So for example, maybe Muhammad Ali, as someone who had been injured and not treated or continued to be involved in sport.
Yes, absolutely. And I did allude to that a little bit in the discussion of the chronic traumatic encephalopathy in football players. In boxers, there's another condition called dementia pugilistica, excuse my Italian. But what that actually translates to is punch drunk. And if you've ever seen a boxer who sustained a head blow, that is what they look like. They look like they're intoxicated. But certainly there is a connection to Parkinson's disease. Now we know for professional athletes like Muhammad Ali, like the football players that we've mentioned, they have been active in sports for many, 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 many years and have sustained many, many, many blows to the head without that recovery period that we talked about that's so important. So we don't really know how that translates to younger athletes, which is why it's important to employ the management techniques that we're aware of now.
Okay, terrific. So we're just at about 1 o'clock. I want to thank you, Dr. Boyer, for a terrific presentation, and thank you all for participating in today's Heads Up webinar. We hope you found it informative, and next month Dr. Karen Lindgren will be presenting Teaching Problem Solving Through Cognitive Rehab. And you can watch for details about our Heads Up webinar series and all of our Bancroft programs by following us on Twitter at Bancroft.org or by liking us on Facebook. If you have any questions about today's webinar or any future events, you can contact me. My number is 856-616-6454, or you can email me at my new email address, and that's lynn.tomeo@bancroft.org. So we certainly hope you can join us next month, and thank you again for your participation, and have a great day.